All right, so this should be live streaming on Facebook. If anyone is on, they can confirm. I think we are live on Facebook. All right, so good. Oh, and I will actually, I'll make sure I record the session as well. There we go. So if anyone wants to. All right, excellent. So good morning, good afternoon, good evening to everyone who's joining us. For those who are registered in the webinar, welcome. For those who are watching us live on Facebook, good morning, good afternoon, good evening to you. I am Dr. Akwi Asimbang, and I am the co-founder and board president of the Pan-African Organization for Health, Education, and Research. I'm very excited about today's session. I'm beyond excited about today's session. Excited about our speakers, excited about our moderator. So our speaker today is going to be Dr. Natashya S. Kaoma, who's the CEO of Copper Rose in Zambia. And actually I met her, I don't know if you remember, we met at, I want to say 2019. It was at our mentorship and medical research symposium. And when she spoke, I was just staring. I'm like, oh my gosh. Because her energy, her enthusiasm, I mean, you could see her passion. It's like she was taking you on her journey. So I'm just super pumped and just ready to listen. And our moderator today, happy birthday, embarrassing her. It was her birthday yesterday. So our moderator today is Deborah Adedibu, who is a Poher scholar and a medical student at Obafemi Awolowo University in Ife, Nigeria. And the connection I have with her, it's interesting. I don't know if I actually mentioned this to her before. Pre-COVID, I actually traveled to Ife. I think we discussed that. I was traveling to Ife every few months. We never met. I never knew her. And I only knew her when she became a Poher scholar. You know, she has a passion for youth and adolescent health. And, you know, she's doing a lot of work in Nigeria as well. So I think this conversation is going to be powerful. Our goal as always is to uplift, provide guidance to our youth, to our attendees, and then, you know, provide some mentorship points, and importantly, provide for today's topic, you know, a message about youth and adolescent health. So I will be once again in the background, and Anya Avis Nobuth is also here in the background. We're the tech gurus for today. And we will hand over everything to Deborah. If you guys have questions, type them in the chat. If you have questions watching on Facebook Live, please type them in the chat box, and Deborah and Dr. Kaoma will try to get to them. All right, over to you. I am muting my mic and turning off my video.
Thank you very much, Dr. Akwi, and thank you to Poher for the opportunity to anchor the session on youth and adolescents, the impact it can have on the community and sexual and reproductive health. So like Dr. Akwi said, my name is Deborah Adedibu. I'm a Poher scholar and I'm a medical student at Obafemi Awolowo University, Ife, Nigeria. And today we have Dr. Salifyanji Kaoma, Natashya, today to discuss this important topic with us. And I believe most of us have interest in youth and adolescent health, or at the very least, we're here to gain interest in it. And she has so much expertise and experience in it, and she is just ideal to deal with this topic. So I'm going to go right in and read Dr. Natashya's bio, and then we'll go straight into the discussion. So Dr. Natashya has over 9 years experience in advocacy for youth-friendly services and sexual and reproductive health and rights awareness. She has global leadership expertise such as the Family Planning 2020 Reference Group and the United Nations Every Woman, Every Child High-Level Steering Group, where she supports the inclusion of young people in policymaking with regards to reproductive health. She is also involved in adolescent health research through her engagement as a member of the PMNCH reference group on adolescent well-being. Dr. Natashya is a 2019 Commonwealth Master Scholar at the London School of Hygiene and Tropical Medicine. She is 2000 17 Queens Young Leaders Award recipient, Zambian Women of the Year, healthcare champion. She's an alumni of the Cambridge University, UK, Leading Change, University of Delaware, Women's Leadership, and University of Zambia, Bachelor of Human Biology, Bachelor of Medicine and Surgery. Dr. Natashya Salifyanji Kaoma is a global reproductive health champion, medical doctor, and epidemiologist. She is passionate about the empowerment of youth and women, which prompted her to start Koparo Zambia, a youth-led organization that works with adolescent girls and young women by providing sexual and reproductive health and rights awareness, menstrual health management, and economic empowerment programs. Under her leadership, Koparo Zambia has reached out to over 70,000 adolescent girls and young women and distributed over 100,000 sanitary pads, making it one of the largest youth movements in Zambia. Welcome, Dr. Natashya, and it's such a privilege to have you here with us today.
Thanks, Deborah, and thank you so much to the Poher team for having invited me to come. I'm really excited about this, and I look forward to a great conversation.
All right. Thank you also for taking the time to be here. All right, so I'm curious, and I'm sure a lot of people are curious too, about how your journey has been so far. What made you decide to do adolescent health? Some people would say that they picked their career. Some people would say their career picked them. So what has it been for you? How did you get to work with adolescents and young people?
I think for me, it's been a bit of both. I would say I knew I wanted to be a doctor from the time I was really young. And yeah, a lot of people say that, but for me, I was serious. But once I got to medical school, I realized that there was so much out there was so much in the world that needed to be done. So my interest in sexual and reproductive health really started from high school because I started my period late. Later than everyone. I started it in the last grade of high school. And so that gave me a lot of time to understand other people's sexual and reproductive health needs because I would carry pads in my bag and I would end up giving them to other people. And that made me realize that many of my colleagues had no idea what was going on with their bodies. That was my first interest. I then moved from high school into university and I started working with the Medical Students Association because really I thought there was more to school than just going to class. I wanted to do more for my community. So my medical school had this course called community-based education, and that became my favorite part of the program because I would go out in communities and I would learn and I would see what other people were doing. And from then on, I did more work with the student association, but even then I felt like that wasn't enough because one thing I understood about student leadership was that as soon as you got out of office, someone else would undo all the great things you did. And so because of that, I then teamed up with a colleague and we started Copper Rose. And the name Copper Rose is a plight for women and young people to be appreciated as much as copper is to the Zambian economy, because Zambian economy is driven by copper prices. But we think that if you invest in young people, if you invest in women, then you have the ability to do much more for your country. And so really that's how I started working with Copper Rose, and from then on, so much has happened. But I'm also doing a lot of work on at global level, and my global work came from volunteering. I used to volunteer with the Youth Coalition for Sexual and Reproductive Health and Rights, and it was just a youth movement. We used to do everything online, even before things went virtual. It was hard at the time because internet was expensive, but I was willing to put in the work because I wanted to learn how to do global advocacy. And that opened up many other doors, including some of the global boards that I sit on at the moment. Yeah, in a nutshell, that's really how my experiences have shaped my decision to do this kind of work.
Well, that's interesting to know, Dr. Natashya. I think we have one thing in common in that I started to develop interest in adolescent health when I was in high school. So but for me, it was just like, I would say to myself, okay, when I'm much older, I need to find a way to make sure that adolescents don't have this problem I'm going through. So that was it for me. So Dr. Natashya, can you tell us why adolescents and young people are such a peculiar group? Why we pay so much attention to them and why we need to be particular about their health and development?
So adolescence is the period between ages 10 and 19. And I only realized quite recently that some people don't even know what age it is. So I will go ahead and define it. Adolescence is the age between 10 and 19. I know there are debates in many parts of the world right now about redefining what that age is. But according to WHO and according to the UN, that is the age between 10 and 19 years old. There is the first stage of adolescence, which is 10 to 14. And then there's a second stage, which is 15 to 19. There's another group that I want to define, which is young people, which is from 15 to 24. However, many parts of the world have their own definitions. For example, in Africa, youth goes from 15 to 35. And in other parts of the world, it goes up to 30 and so on and so forth. But this period is very, very important because especially in Africa, a huge proportion of the population is in this age. They say there are more than 1.8 billion adolescents in the world today. And that means that a huge percentage of our population is at a stage where there's a lot of physical, cognitive, and psychosocial growth happening. Because of all the growth that happens at that stage, adolescence has the power to determine how people think, how they feel, how they make decisions. Remember, Deborah, you just mentioned that you developed a passion for adolescent health when you were an adolescent. So that means, and you're studying to be a doctor right now. That means that at that stage of your life, there's so much that could happen that determines how far you go and what you do for the rest of your lives. And because of that and the power that comes at that stage, it becomes a very important group that we need to pay attention to, because that's the time when we instill values. That's the time when people choose what careers to do. That's the time when people are at risk of abuse and those kind of things which have a psychological effect on people happens at that stage. So I would say that because of everything that's going on, the rapid growth, the psychosocial growth, the ability for that stage to determine what your life path is like, it becomes a very important stage.
Wow, that's great. So in your many years of working with adolescents and young people, what do you love the most about it? What are your fond memories, and how has it affected you?
When you say many years, you make me feel old. Because I would say that the time I started doing this kind of work, I was an adolescent myself. And what I love the most is just seeing myself close to them, because I may look confident right now, but when I was young, I had self-esteem issues. I wasn't sure if I really wanted, like what I wanted to do. I knew I wanted to go into medical school, but in between now and that time, there was a lot going on. And because of that, I see myself close to them because I know that anything can happen at that stage. And if you make the wrong decisions, things could go wrong. So I always like working with young people because I don't see myself different from them. I also like to see change happen. I like to see how small things like an encouragement makes a huge difference. I like to see how things like scholarships and opportunities for education have a potential to change the trajectory for someone. But I also like to see growth, because there are some people I started working with. I can see someone on the attendees list. I won't mention their name because I don't want to shine the spotlight on them, but I started working with them as an adolescent, and now they're doing great things by themselves. So I like working with them because I see results, and that makes me sleep well at night.
That's great. But despite all these amazing things and all the change that you can make, I'm sure it hasn't been without challenges. And can you share some of this and how you were able to overcome these challenges?
There are many challenges that I could mention. I could mention challenges in terms of my work. I could mention challenges in terms of what young people themselves are facing right now. I could also talk about challenges at country level. But I want to say that the adolescent age gap is really wide, and I will zero into what the challenges are of an adolescent right now in Africa. The age gap is very wide, and each of those, at each age and at each stage, there are different needs that young people have. For example, a 10-year-old and a 19-year-old have got different needs. And that in itself makes things sometimes much more difficult for programming purposes, because, for example, sometimes most of the programs for adolescents will be focusing on sexual and reproductive health, but a 10-year-old, they can't quite relate. Sometimes some programs will be focusing on urban young people, but the problems that people in urban areas and rural areas are facing are very different. So the diversity becomes a challenge, because structuring programs that have the most impact for each of those groups is not as easy as it sounds. I'll give you an example. If you go to a rural area, some of the challenges they will be facing are things like no access to water, schools are far from where they live, and sometimes they lack motivation and inspiration, because most people that have succeeded from that area have moved out of that area. So they don't have access to mentors. But even the adolescents from the highest socioeconomic status still have challenges, and sometimes they're dealing with mental health issues. Sometimes their problems are not money or access to information, but their problems are maybe they don't have someone to listen to them or talk to them, and things like that. So some of the other challenges are the diversity of the group. And lastly, cultural and religious challenges, because at adolescence, mostly what your beliefs are is dependent on the beliefs of those around you. And that's at a stage when a young person is trying to develop their own thought pattern, their own way of doing things. And it may sometimes be different from what they've been brought up doing. So coming out to say, I think I understand what I want, becomes hard when the people around you have a different set of values from what you are choosing to believe in. And that becomes a challenge.
Okay. So you mentioned different problems that adolescents face: cultural, religious, mental health. So what would you say is the biggest problem that adolescents in Africa face? And what would you say is responsible for this?
So in Africa, according to the World Health Organization, from the last data that was available in 2015, there are about 196.5 million adolescents, which is about 31% of the population. Now, the biggest challenges that adolescents in Africa are facing are things like early pregnancy, childbirth, and child marriage. That is the leading cause of death from girls aged between 15 and 19 in Africa. So most of them are dying from childbirth and the complications of that. And when you think about it, about 10% of all births worldwide are from adolescents. And we all know that early pregnancy comes with its own complications. There are complications of septic abortions, because sometimes adolescents want to get rid of the baby because they're not ready, and that becomes a challenge. Sometimes their bodies are just not ready genuinely to have a baby, and that becomes a problem. But in terms of life and death, pregnancy and childbirth present the highest burden. Another thing that causes high burden in Africa is HIV. There are more than 2 million adolescents that are living with HIV in Africa. And HIV has been one of the reasons that we're even shining the spotlight on things like sexual and reproductive health. But we all know that in the last 20 to 30 years, HIV did cause really high implications on even the social and economic well-being of the African continent, including things like our life expectancy and disease burden in general. So HIV also has proven to be one of the biggest problems that are facing young people. And it's surprising, but you may not be aware that diarrhea and lower respiratory tract infections are estimated to be one of the top 5 causes of death in Africa. And this can be attributed generally to poverty. Yeah.
Okay, so you've mentioned early pregnancy and death, HIV, diarrhea, and infectious diseases as the major problems that adolescents are facing in Africa. Are these problems, are they different from what adolescents in developed countries are facing? And should this also influence how we design our interventions for Africa?
Definitely. When you look at the top 5 causes of death amongst adolescents around the world, the picture is very different from what you will see in Africa, because in Africa, most of the causes of death are related to poverty or somehow point back to that, things to do with diarrhea and lower respiratory tract infections. Diarrhea, mostly you're thinking about access to clean water, access to good health facilities, whereas in developed countries, for example, in the US, according to the CDC, the top 3 causes of death in adolescents are suicide, homicide, and unintentional injuries. Unintentional injuries like road traffic accidents, accidents that cause death, or even just unexpected events which have to do with trauma. But when you look at Africa, we're dealing with things like early pregnancy and childbirth, and in developed countries also something that's very common are non-communicable diseases like cancers and others. And so when you look at those 2 kinds of problems, dealing with suicide, homicides, and unintentional injuries has a different strategy compared to dealing with pregnancies and childbirth or diarrhea and lower respiratory tract infections. So definitely there has to be different interventions in order to deal with these. And one of the main ways to do this, and I know we will discuss this further later, it's also looking at data and how we're using the data we have to influence some of our policies and programs.
Okay. So looking at all of this, because it's a lot actually, different problems and different ways to tackle them. If there was one thing that we could do to just generally improve the health of adolescents, what would that thing be?
I'm biased when I say this because I work in public health. I would say if I could do one thing, I would invest in programming for adolescents. I would say invest in programming because right now, most of the programs that are dealing with adolescents are either embedded in maternal and child health programs or embedded in pediatric programs, pediatric meaning children aged from 0 to 15. And so there's this gap of adolescents who they're not mothers, their problems are not maternal health related. They are just left somewhere in between the sectors. So I would invest in programming for adolescent health. And some of this programming would be for delivery of services, awareness raising, and in more like social and behavioral change communication interventions. But also investment would also allow for a multifaceted intervention because the needs of adolescents can't be restricted to one sector. They can't be restricted to health or education or sports or social sciences or social amenities. It has to be a comprehensive package. And some of the barriers to a comprehensive package has been with the way the investments are done. There are all these sectors. The HIV has its own sector. SRH is its own sector. Those focusing on children are their own sector. But one thing that we need to understand is that all these sectors are targeting the exact same person. And once we start to understand that, and once the investment starts to look like that, I believe we'll see better outcomes for adolescent health and well-being.
Okay, thank you, Dr. Natashya. So you've talked about the HIV section, the HIV sector, the SRH sector. But if we look at a large number of the interventions that are available to adolescents, a large percentage of them are focused on SRH, and very few are focused on other aspects like their education, their mental health. So do you think this is the right way to go? Do you think we are neglecting the other sectors, or is SRH so important that we need to focus on SRH?
Well, this is very complex, mostly because there are many sides to this. You are right that most of the efforts around adolescent health have been focused on sexual and reproductive health. For example, Zambia as a country has got an adolescent health strategy, and the strategy has got 6 pillars. Of those 6 pillars, 2 of them are related to reproductive health, and the other 4 are general, for example, NCDs and things like that. But when people talk about the strategy, they usually use it only to talk about those 2 things. I would say one of the reasons is because we have more data on sexual and reproductive health outcomes, and we have less data on mental health. There's less information showing us the state of affairs, whereas there's more information showing us of the maternal deaths that have occurred. X number were adolescents. Of the births that have occurred, X number have to do with adolescents. So there's more data on sexual and reproductive health, especially in the African setting. And that's why we have more information about this. And that's why most of the interventions have been around sexual and reproductive health. Secondly, sexual and reproductive health needs are just more tangible for the average person to comprehend, because you could point out how many people have got this number of how many people have died or how many people have been infected with HIV. Whereas for some of the other adolescent health needs, we just don't have that much information. So the average person can't quite understand. When you look up mental health, even not just for adolescents, but even for the whole country, for all age groups, do we have that data? Do we have data on the NCD prevalence in the country? Do we have data on how many people are living with diabetes or hypertension or things like that? So some of the effects of this are not just because we're not getting this information about adolescents, but it's a reflection of the status of data even for other aspects of health for the whole country in general. Because once we start collecting data about mental health for the whole country, then we will have information to work with to figure out how many young people have mental health needs as well. So sometimes I think it's just a byproduct of or a consequence of some of the disparities existing in our health system. And I'll play the devil's advocate and say, sometimes we're also a victim of the funding priorities because largely the budget for healthcare in Africa, a huge part of it does come from donor investments. And sometimes what the donors are prioritizing ends up being what countries are prioritizing. And so that's how we end up like that.
Okay. So with all the information that we have and the data that we have on SRH, can you please tell us how the sexual and reproductive health of an adolescent, how it affects the adolescent's life and the community at large?
Well, there are many ways to look at it. First of all, it affects the adolescent because, one, sometimes if a girl gets pregnant and she's not able to go back to school, so girls are not staying in school. And when someone doesn't stay in school, it reduces their ability to earn money. It reduces how much they can contribute to the workforce. And it reduces their productivity. It reduces their contribution to the country. I always have a saying to say that if half the population is not contributing to the economy in a country, then the country is only working with half of its potential. So if girls don't stay in school, mostly because of teenage pregnancies or early marriages, then that affects the country overall. There is also some research that has been done that shows that some of the sexual and reproductive health implications do have an impact on the country's statistics. For example, maternal deaths, septic abortions, and because some of these pregnancies result in an increase in maybe young people dying or the total number of women that have died. And maternal mortality is a very big indicator for national development because no one should die giving birth. And some of the implications of poor reproductive health education is that because sometimes women could get on contraception and have access to contraceptives, which could improve some of those outcomes. Another thing I want to mention is that a lack of good sexual and reproductive health also has implications on other aspects of health. When you look at infant mortality, mothers who have even gone up to high school or have high school education, their children have got better outcomes than those mothers who have not had an education. So this does not only impact the life of that young woman, but it also impacts the future of her children, and that impacts the country's statistics as well. But also, I also like to remember that a statistic is a person. We can say there's this number of people that have a certain disease, but that is also a person, and nobody should die because of preventable things. And lastly, I want to talk about how sexual and reproductive health issues affect communities. They affect communities in the sense that right now in Africa, we are still battling with sexually transmitted diseases. And when people have disease, they are less able to contribute. I'm sure we all may know someone that is living with HIV or have been impacted by HIV. And that can give us a reminder of how we've lost a lot of the productive people in our societies because they either died from HIV or they are sick. And when someone is sick, the caregivers are also losing time from work to give out that care. And what that does is that it reduces household savings or household money. And that also has a long-term impact on the quality of life. I'll pause here for now.
So I think that further explains the importance of sexual and reproductive health, how it not only affects the adolescent's life, it affects, if for early pregnancy, it affects their children's life, it affects their community too. So when we talk about sexual and reproductive health, it might sound a little vague to some people. So when we talk about SRH, what are the factors that contribute? What are the factors that come together to contribute to the sexual and reproductive health of adolescents and young people?
Thank you, Deborah. I'm tempted to talk about this. Okay, so a few weeks ago, someone asked me, and this is someone that has been working in this sector, and they just asked, like, what is SRH? Like, what is sexual and reproductive health and rights? And really, it pertains to everything that has to do with the sexuality of someone or the sexual well-being, which is, if I have to pick out certain topics, and I must mention this is in no way exhaustive, but it entails things like family planning. You talk about anything to do with reproductive health, including things like menstruation, sexually transmitted diseases, knowledge about reproduction, even just knowledge about your own body and knowledge about your rights and things which you can do to improve the quality of your reproductive health. I know I'm using the same word, but I just want you to think, if you want to think about sexual and reproductive health, think about everything on your body that pertains to reproduction and how that is affected by your thoughts, how you access services, how you access information, whether you can go to a hospital, including the social, economic, and financial impacts of that. Now, some of the factors that have affected access to sexual and reproductive health, or even just sexual and reproductive health in general, largely in this part of the world, culture and religion. Culture and religion plays a huge role in this because religion, unfortunately, does use women's bodies. Like women's bodies are discussed. And I find that unfair because as a woman, I believe a woman has the right to autonomy, which means that he or she, in fact, not just women, everybody should be able to make decisions about their body, what kind of contraception they want to be on, when they should have sex, and all those kind of things. But culture and religion are structured in such a way that a certain group of people or a certain have put value on certain things. For example, some cultures find having more children to be more valuable than having fewer children. In some religions, people preach about whether you can use a condom or whether you can use a contraceptive. And because also when you look at it from a Christian perspective, Christianity is made in such a way that it's not about you and what you're doing. It's about you bringing other people to understand what you're doing and getting them to change. So what that does is that people can have autonomy, but Christianity is in such a way that you have to preach to another person to change their ways. And that in itself does cause some of the barriers we see, because when policymakers go out there to make policies, they will be making them based on their own individual values. And because they are Christian, they will make them based on what they think God would like to see in a country. And what that ends up doing is that the individuals, whether they are Christian or not, or whether they are Muslim or not, will be forced to live their lives based on those laws. And those are some of the ways that culture and religion plays a role on sexual and reproductive health. Another factor that influences sexual and reproductive health is poverty or lack of finances, because someone may know that they should use a condom, or they should protect themselves, or they should negotiate for what they want, but often they just don't have money to be able to do that, or they are using their body as a means of raising money for something that they need. And for some people that we've worked with, they'll tell you it's either use a condom or I go hungry. And those are very hard decisions to make in that moment. And it's easy to tell someone what to do. But when you look at it from that perspective, you start to understand some of the ways that people make decisions. So poverty does play a role in realization of sexual and reproductive health and rights. And that's why things like education, things like poverty alleviation are very important for people to realize their good sexual and reproductive health rights. And lastly, one of the other factors that does affect sexual and reproductive health is a lack of information. There is just not enough information. While there may be more information in urban areas, there are also a lot of myths and misconceptions about reproductive health, because it's a taboo subject. Nobody wants to say anything because they don't want to be labeled as naughty or as uncultured. And because of the way there are many taboos around it, it becomes a problem. I was just speaking to someone today, and there is a lot of talk on radio, on Zambian social media right now about erectile dysfunction. And no one has a problem with talking about that. But when people want to talk about something like abortion, or they want to talk about contraception, there are all these things, and people saying, no, this should not be discussed in this forum. But erectile dysfunction is somehow cool and acceptable. And those are some of the barriers I've seen in my work that I find unfair.
Okay, thank you so much, Dr. Natashya, for that. It just shows that sexual and reproductive health is multifaceted, and it's health quite all right, but it's influenced and affected by the economic factor, by culture and religion, especially when you're trying to design an intervention and educate a certain group of people about why they should probably change this or why they should adopt this behavior. But they have myths, they have cultural and religious beliefs that go totally against it. And I think that also points to a major influence in the community. For example, the religious leaders and the community leaders, how they can play an important role in influencing people's beliefs about their health. So I'm saying all of this about adolescents and their health. When we say a healthy adolescent, what do we mean? What does a healthy adolescent, what does that mean? And what does their life look like? Is that even possible?
It's possible. Health is defined as a good state of physical, social, psychological well-being. And I don't think that definition should change based on the age. And so the way we define health for an adult should be the same way we define health for an adolescent. And I think in my own words, I would say that a healthy adolescent is someone that has got access to healthcare. They're in a good state of physical well-being. They don't have pain. They don't have what can I say? They're in a good physical state. They're in a good mental state as well. And they're open to talk about what state they're in and reach out for help when they need to, without being made to feel like it's not important. Because oftentimes when people think about things like mental health, it's always pushed to the side. As long as you're alive, you're walking, nothing hurts, you'll be fine. Also, sometimes mental health issues are then pushed into something religious, or they're made to feel like someone is attacking them or things like that. And so they don't have access to that kind of care. So I would say a healthy adolescent is someone that is in a good physical, emotional, and mental state. And at any point when that state changes, they're able to get the help they need.
Okay. So in Africa, can you say we're close to helping our adolescents live a healthy life, or do we have a long way to go?
I'm a very optimistic person. I would say that we've made great strides in the last 20 years in all of these indicators, which is a good thing. And I think we'll only get better. Yeah.
Yeah. Yes, I think so too. So about designing interventions and improving the health of the adolescents, we've talked about different sectors that are involved. So what exactly can the government do? How can they come in to improve adolescent health in Africa?
Government, its biggest role is creating an enabling environment for adolescent health interventions to be done. An enabling environment would be at policy level. What kind of policies have been put in place to allow adolescents to access services? And when you think about policies, you think of things like age of consent. At what age are adolescents allowed to access the services? Some countries have got very good policies in Africa, but the implementation of those policies, I'll give you an example. For example, in Mozambique, their laws do not say anything about age when it comes to accessing services. And what has happened is that in Mozambique, they've been able to reduce their teenage pregnancies because they've now brought the contraceptives to the schools where the young people are. Another thing I would like to say is that one other role that government could play is in the provision of health services. And provision of health services is not just having a hospital, but it's, are those hospitals equipped? Do they have the right medications? Do they have insurance systems or things like that, which enable young people to be able to access these services? And lastly, data management. Having received training in epidemiology, one thing I've come to understand is that it's very important for us to have data about what's happening in our countries, because that allows us to make real-time decisions. And so I'm always for the idea of getting our systems to be able to collect data much faster and much quicker, because that way we'll be able to make decisions based on that. Oftentimes we are using things like the DHS, or which is the Demographic and Health Survey, and those things are not done every year. For example, right now in Zambia, the last DHS showed us that the teenage pregnancy rate is at 28.9% or 29.2%. But what I said is, with COVID, so much has happened. There are so many more girls getting pregnant, and we don't even know how many they are and what that rate has become after the pandemic. And if we did, we would be able to make faster and real-time decisions. But when it comes to data, it's not just availability. For adolescents right now, we are also dealing with lack of aggregation of data, because sometimes young people are bunched with the women. So you'll see in the hospital record system, it will say above 15 or above 18, but we need to know the actual ages so that we can put in place interventions in that regard.
Okay, thank you, Dr. Natashya. And there's something I read in your bio that I think is also very important, and that's including young people in policy making. Like, you shouldn't design an intervention for a group of people without involving them in the planning of it and the designing of it. So, well, I'm sure that the government, it's not something that the governments can do just by themselves. And also in situations where the government is not forthcoming in providing all of this, what can non-governmental organizations or just individuals do? People who are interested in improving adolescent health, sexual and reproductive health.
There are two ways of looking at meaningful youth engagement. And I'll say this because I now sit on national technical working groups, national think tanks, and things like that. And sometimes I'm the youngest person in the room, and I'm not that young. From my experience, I think meaningful youth engagement is twofold. It's twofold in the sense that, one, sometimes people bring young people into meetings, but those young people have no idea what is being discussed. The information is not broken down for a young person to comprehend, and that limits their ability to contribute to that discussion. So you would be in that meeting, or I see young people in meetings and they can't even contribute because the acronyms, it's an acronym show really, because everything they're saying is in these acronyms that are not being broken down. But one thing I also do know is that as a young person, if you want to be involved in adolescent health or anything you're passionate about, you also need to build your skills. So as an individual, you need to build your skills so that you can sit in that room and be able to contribute, which means lots of reading, going for those same meetings, even if you don't understand what they're saying, but you could write down all those acronyms and look them up so that the next time you show up, you'll be able to contribute. So what we've been doing at Copperose, for example, is building capacity of young people to understand national policies and national documents so that even when they are called to these meetings, they can contribute in a much more valuable way. Other organizations can do this by meeting some of the gaps that government hasn't been able to meet. For example, building capacity of healthcare providers to do adolescent health adolescent health-centered service provision, as well as supplementing government efforts. I do advocacy work quite a lot, but one thing I see is that advocacy is not about pointing out what government is doing wrong, but it's also understanding what could be better and then using that as a way to contribute also in a way. So if you identify that commodity stockouts are the biggest problem, what can Copperose do to improve delivery of those things, while at the same time holding government responsible, but also being part of the solution?
Wow, that's great work. So I'm going to bring this into Copperose now. Like how do you monitor and evaluate your impacts? Like how do you say, oh, okay, this is how much change that we're making, and this is how much more work we have to do? Because I think it's something important that interventions and organizations have to learn to do to be able to measure the change and impact they're making in the community.
I will talk about that, but I also want to talk about something just before I get into the monitoring. I want to say, as a young person, you just need to start. You need to do something, because often when we hear these monitoring frameworks and all these tools that are supposed to be used to track and some of these national documents, it just feels overwhelming and you just decide not to do anything. So if you're a young person listening to this or you're a student, just start. The truth is you won't know what you're doing, and that's fine. Sometimes the adults don't know what they're doing either, but we don't know they don't know. So people won't know that you don't know. So just do it. So I would say that if you're a young person trying to make a change in your community about anything, just start and you'll figure it out along the way. And then when it comes to monitoring, there are a lot of frameworks that are needed. For example, we track how many people we reach out to. We also track what the impact has been. One of our biggest pillars is impact. And we think of impact not just in terms of numbers, but also in terms of how it's affecting you as an individual. So we can train 1,000 health workers on adolescent health programming. That's great. Our donors will be happy. But we're also going to go back and ask, what more did we do in addition to that training? And some of the feedback we receive is things like, you inspired me to do something about my own life. And I get all these messages like, hi, thanks for your training. I've started my own business. Or hi, I'm going back to school. So we are evaluating in terms of numbers, but we're also evaluating in terms of impact. We're feeding into the national health systems. For example, the number of healthcare providers or number of people that the government wants to reach. But as Copperose, we're also looking at it in terms of individuals. The people that work at Copperose, how has their life changed from the time they joined? We see things like they can speak up better, they can understand things better, but also their families' lives are being changed because they're also supporting their brothers with school fees. And so for us, impact is our biggest priority, in addition to the numbers and all those M&E frameworks that our donors require.
So you guys, you heard Dr. Natashya, just start. And I like what you said about looking at the lives of the people in the organization, people that are working, how their lives have improved. Dr. Natashya, this has been such an enlightening session, and I'm sure it has been for our participants too. I'm just going to look at the chat to see if we have some questions. So there's a question here that's asking, how do you manage to have time to walk through all of that? Like, how do you make time for other things apart from work, family, and friends?
Well,
Okay.
do I have to answer that now, or do you want to ask me a couple of questions and I can answer them at the same time?
Okay, I think Dr. Akwi wants to answer that one, so maybe we'll leave that for later.
Oh, no,
And
no,
the
I
second
don't.
question,
No, that's
okay,
okay.
okay.
No, I don't. I think she should answer them, and there's tons of questions. Maybe she can answer one at a time.
Okay. So we'll just start with that then.
Okay, thanks, Bertha, for that question. I've been working with Bertha for some time now. Yeah, but she always has more questions to ask me. Thanks for that. Well, in terms of time, when I started doing this work, I was a student and I was a medical student, and I know how much work that is. But one thing I always say is there's always time for things that are important to you. And it's just about aligning your priorities. What is important to me right now? At any given point, there's something that you could cut down from. And one thing I cut out when I was doing this work as a student was watching movies or any kind of entertainment. Because I noticed that even in medical school, there would always be people going around with flash drives of movies and like things people do outside school. So I cut out a lot of those things. And even now that I have a bit more time, I struggle to watch anything because I just get bored. So that's something that I had to cut out. One, I think if I have to summarize this, one, there's always time for things that are important. You need to cut out on, figure out what you spend most of your day on and cut out some of those things. And I identified that I spent a lot of time watching series and I just cut them out completely. Two, also your family and friends need to understand what your priorities are, because also a lot of young people spend a lot of time socializing. It's great for your mental health, but it sometimes goes beyond what you actually need. And that's an area that you could also cut out. And once you set your priorities right, your friends and your family will understand what your priorities are, and they won't ask you to come for all the parties and all those kind of things. I would say that that's how I managed to do that. Yeah, and also using my free time wisely, because once I got to see that, like, if I'm free, then I'm going to catch up with everyone that I haven't seen in a while. Yeah, but if I have to say, to bring it to one thing, it's prioritizing.
I think that's something that I also have to learn, especially the series part. Okay, so the next question here, I think it's been answered. How do you measure impact? So that's been discussed. The next question says, it's always awesome to listen to you, Dr. Natashya. How do you look for opportunities, or rather, how do opportunities find you?
I would say you have to do both. You have to look for opportunities, but opportunities will also find you. I'll say this in two ways. When I was just starting out, I was looking for opportunities to learn, not opportunities to make money. And that's the biggest thing I've seen young people face. Whenever they see something, their first instinct is, how much money will I get? I used to volunteer with a youth coalition for sexual and reproductive rights. And at the time, data was so expensive, but I used to buy data so that I can attend the calls. I would travel and not really get any per diem, and they would just cover all my costs. And that was fine. So you need to get to a point where you're not looking for money, you are looking for experiences. Because the time you will write your CV to apply for something that will pay you, you will use those opportunities to say, as for me, Deborah, I know how to write policy briefs. I know how to do this. Right now, most of the work I do is paid work. But I got to know this paid work because of the work I did for free. I always tell volunteers that come to corporals that I don't think it's fair to expect corporals to pay you to learn. Why should we pay you to teach you stuff? And people think it's tokenistic and things like that, but no, when you build your value, the paid opportunities will find you. And so that's, I think, is a priority. But also there are lots of websites which share opportunities. There's Opportunity Desk, Opportunities for Africans. Those websites are very good. There's another one called Youth Op. I will type some of them in the chat box. You can go there and apply. And one secret I've said is that please apply as many times as possible. Expect a success rate of 5%. So if you make 20 applications, maybe only 2 or 3 will be successful, and that's even less than 5%. But I'm just saying that you have to make a lot of applications and learn as much as possible, contribute as much as possible without expecting any reward. And that's the only way you will build your capacity such that 5 years from now, you can tell people, okay, I charge $5,000 to do this. And people will be like, okay, fine.
Well, yeah, the like you said, the importance of volunteering cannot be overemphasized. There's somebody here asking to share your contact details. Then the next question says, do you partner with other organizations? And how have you managed as corporates to be so consistent?
So I've typed my email in the chat box. I think I've typed it to panelists, but I will try and type it to everyone. Well, we do partner with other organizations, and usually in partnerships, we are looking for it in such a way that it's mutually beneficial. But also as corporates, we have a portfolio where we're also building capacity of other youth-led organizations, because if we could do it, other people can do it too. And so if you check out our page, you will see opportunities where we build capacity of smaller youth-led organizations and groups. And if you follow our socials, you will be able to see lots of those opportunities. But if you have any other ideas for partnership, you can always send an email to our info email address, and I'll type it in the chat. But also, if you just Google Corporates, the email address you will see there, you should get a response, and we will be able to give you feedback.
Okay. There's another question on measuring impact that's been talked about. So Beta Chulu says, Dr. Natashya, have you ever considered writing a book?
Yes, I have. I've been journaling quite a lot for the last couple of years. I know I will write a book one day, but I just don't know at what stage the book would be useful. Is it a book for young people in their 20s or 30s, or do I want to write a book about my life when I'm older? I'm not sure about that yet, but yeah, I have been writing, journaling my life and my thoughts, and I'm hoping to put that into one place one day.
I do look forward to reading that when you eventually write it. So the last question I have here says, Dr. Natashya, I have really followed you. I'm on a startup for an organization dealing with sensitizing young girls on early teenage pregnancies. My question is, what has really kept you consistent in your journey?
My support system has been really kept me consistent, because you need to have a dream and a vision that is so big that it's not just in your own head. Because there are days when things in your head are not, they're all fuzzy, there's too much happening. So your vision needs to be in such a way that you have also shared it with other people. Your support system, is it your family, is it your friends? Do you have a co-founder? Those people are very important, because on days when you've given up, they are the ones that are going to wake that dream up when it's sleeping in your own head. In theirs, it will still be ringing. So my co-founder and I, Faith, we strengthen each other. When she's given up, I'm there. When I give up, she's there. And I think it would be unfair to sit here and say that I haven't felt like giving up. I have. But because my support system has been very strong, it has made things so much easier. But also knowing exactly where you want to go and what you want to do is very important. I usually say for young people, you need to know exactly what you want. It may not be in its exact form, but you need to know as much of it as possible. That way, even when things are not going well, you just stay put and do that. But also, support is also in building your own character as a leader. You need to build a lot of your character. Do a lot of exchange programs, education programs, leadership development programs, because what those programs do is that they give you a lot of self-awareness. And that's one of the most critical things you need to help to keep you going, because you reach a point where you know that, for me, I know that doing this kind of work with young people, that's what makes the most sense to me. So even if things were not working, I might think, okay, let me stop doing this, let me go find another job. But because I'm self-aware, I know that doing this gives me the most satisfaction. I will do it up to a point when I know that it has worked, or until it works. So leadership development programs are very important, because what they do is they sharpen you, and they give you clarity of mind. And that's one of the most important factors for leadership. So for that person that's saying that, is try and do a lot of leadership programs. I did a number of programs with the US government. There was a program for women's leadership at University of Delaware. I've done a number of them as well with the Queen's Young Leaders program, and with many programs. And some of those websites I mentioned could help you get leadership programs, because those things keep you going. I also saw another question about burnout and stress. Burnout is real, especially for founders. And I think you need to reach a point where sometimes you just accept that some things can't be done at that moment. And burnout comes from a point where you feel that something absolutely has to be done, and you keep doing it until your body fails you. Or so sometimes you need to reach a point where you accept that, okay, that report can't be sent right now. You either ask for more time to do it, or you do it at a later time. And sometimes for me, it's been things like moving a deadline or taking a break. And while that may sound bad, that's one of the ways that you can beat burnout, especially as a young founder, because sometimes some things are just not there. But also delegating helps. Having a team helps, because not everything is resting on your shoulders. But taking time off is everything. And acknowledging, knowing when to take that time off, knowing that, okay, I'm slowly getting to this point. I started having self-care Sundays, and on Sundays, I just wash my hair. And natural hair wash day takes long. So yeah, Sunday is self-care Sunday. I wash my hair, I take a long bath, and I spend less hours. I don't say I don't work. I still work on Sunday, but I work less and use that time to plan my week. So small things like that help make things easier. Trying a new sport, hanging out with people you love, those things really do help you reduce burnout and deal with it before it gets bad.
Okay. So there's a question here. Thanks, Dr. Kaoma, for the brilliant and awesome presentation. So enlightened. I'm Kenan Amunga, a final year medical student from Nairobi, Kenya. My question is, as an SRH practitioner, what has been your experiences on the impact of COVID-19 pandemic on SRH and the challenges so far, given that the science of medicine is highly dynamic in line with the prevailing circumstances, and what are you doing about it?
Well, the COVID pandemic has been tragic, mostly because we've lost a lot of people. People have died. At community level, we're seeing that there are higher teenage pregnancies because schools closed for a prolonged period of time. People have also lost their jobs. And when you say working from home in Baltimore, Maryland, or in some other place in a developed space, you're going to work from home. But think of someone that lives in a two-roomed house with 6 other people. How can they work from home? Also think about the low-level jobs, which don't have that privilege, because working from home assumes you're on a laptop. But imagine if you wash dishes. If the restaurant is not open, then you're not working at all. So there's been that economic side to COVID, and what that has translated into is higher levels of teenage pregnancies. We're also seeing some diseases being diagnosed late, things like cancer. We're seeing that is harder because people are not going to the health facility. I'll be very honest with you. I wish we had more data on the impacts of the pandemic. As Corporals, we did a research, which we are yet to publish, to show how COVID has affected sexual and reproductive health in general. What we have seen is that there are more pregnancies and there are more antenatal visits, but there are also less hospital deliveries. We have also seen that the youth-friendly spaces have more traffic now that schools are closed than when schools are open. And the youth-friendly spaces have like 10 times more young people going there than before, which means that our programs need to be more robust to capture those kind of people there. But it also shows that schools could have been a good place to share information for young people. What this could do for the sector, for the health sector, is that right now there's a lot more investment in healthcare. And so this is a very good opportunity for healthcare advancements. We've seen hospitals being renovated. This is something that wasn't done all these years. We've seen hospitals being renovated. We've seen investments going into the health sector. And for organizations like Copper Rose, what we've identified is that donors are much more willing to invest in community solutions than in international organizations. So we have also seen increase in funding because donors understand that we are on the ground. We don't have to wait for a team from whichever country to come and tell us what to do. We have been given the power to make those solutions. So those are some of the good things that are coming from a sad situation like this. But we're not looking at it in terms of money, but we're looking at it in terms of an opportunity to build our capacity such that we will ask for less from the outside going forward and will be much more self-sustaining.
Okay, thank you, Dr. Natashya. The question here is from Veronica Musa. Do you offer mentorship program for a startup like me?
Well, I would say yes. I do have some young women I've been mentoring over the last couple of years. Usually when I'm working with young people, it's very self-driven. So yeah, definitely you could send me an email and we could see what we can do. But yeah, that's something I would do. So just send me an email. I've typed my email in the chat box and I will be happy to respond.
All right, thank you, Dr. Natashya. It has been an enlightening section. That is all the questions that I have here. Thank you for taking the time to talk to us today, to talk extensively and share your knowledge on adolescent and youth health, especially sexual and reproductive health. Thank you also for being a reproductive health champion. Thank you for inspiring the rest of us. Thank you for improving the health of adolescents around in Zambia, especially, and also globally. Thank you. I don't know if you have any concluding words to leave us with.
Was that me or Dr. Akwi? Okay. Well, if I have to conclude, I would say everything's possible. The power of desire is one of the most important things, and I think people don't talk about it enough. You have to want something, and a lot of people just don't know what they want, or they're still trying to figure it out. The best time to decide what you want is when you're young, when you're a student. That's the best time to try things out, because when you start early, you give yourself a lot more time to figure out what works and what doesn't. By the time you're reaching 25, 28, 30, you will have more information. You will figure out what you like, what you don't like, what you can manage and what you can't manage. Some of the most successful people in the world have been successful because they started early. You may hear of those overnight successes, but I always say behind every overnight success, there were years and years of preparation. So you might start something now that doesn't work, but that will give you lessons and strength to do bigger things in the future. I also want to emphasize on volunteering. It's one of the most important things you can ever do for yourself as a young person, because those skills that you get from doing something for free or just learning as much as possible will come in handy much later in life. And lastly, yeah, I just want to urge everyone that's watching this to dream big and think about your health. And as a young person, or as even an older person, you should never be ashamed of your sexual and reproductive health choices. And the more you are open about it and talking about it, the much better your outcomes will be, because you can get help when you need to. A lot of young people feel like, no, if I go to the hospital, the nurse will say this, she'll say that, but if you don't, you might get HIV and she'll say something anyway. So if you need sexual and reproductive health services, never ever be ashamed to go there. Even if someone tells you something that you don't like, your life is more important than what they think. Yeah.
Thank you so much, Dr. Natashya. I, for one, am leaving this session better than when I joined. And thank you for all that you've shared with us. Thank you. So that's all. Thank you to our participants for participating and for being patient. So over to Dr. Akwi now.
Thank you. So yeah, I definitely want to thank, both of you. I think I've been, close this. So you've mentioned just very, very important things that, I don't think we can overemphasize. You talk about mental health in the youth. What I loved when you started speaking was how you gave the definition or the age, wherein you're like 10 till 19, or, in some places 15 to 35. But the point you made that I think is really important is, what a 10-year-old needs would differ from what a 19-year-old needs. So I think that's important. And then the other important point you mentioned is, the support system. I think that's something that's really important for our youth as well. But even as you get older, that's something that you'll always need, having a support system to help you succeed. Like you said, go to the nurse, go to whoever it is with whatever question you may have. It's like they'll say something one way or the other, but the sooner you go, the better. I loved your point about volunteerism. You're so right. I liked how you kind of tied that in, where it's like because it's like with coaching. So it's like when you love something, you want to do something, you shouldn't be thinking of how am I going to make money off of this, but it's like, what can I learn from this opportunity? The money may eventually come, but if you're going in with a passion of what it is you want to do, I think that's extremely important. And like you pointed out, I think there was also another post you had on your Facebook page where you sort of mentioned how when you start something when you're young, that's something that can impact you later on in life. So I absolutely, love that. And I love your passion. I love how you also commented about how you sort of started Copper Rose in terms of, you had this interest in med school, and, you shared your personal story with us about period. And I think that's something people don't talk about. There's this taboo about, women talking about their periods and things of that sort. It's like, it happens. But the comment you made that I think was really important was how you had this idea. And you mentioned how there's a change in government, a change in politics, there's a change in leadership. So if you leave your idea as is, it may not necessarily carry on as you envisioned it, but you sort of took that with you and grew with it, and then the self-care Sundays, love that. Natural hair, I totally like had a laugh. I'm like, I'm with you on that one. I cannot thank you enough. In terms of preparing for this. I am also very motivated, pumped. I love to just do it. It's not going to be 100% when you start, but just do it. I mean, you are a true leader. You're a mentor. You're a motivator. You're inspiring. I troll you on LinkedIn. I troll you on Facebook. I'm just trolling you, period. And on behalf of Poor Hair, 100%, we appreciate your time. We know you're super busy. It's a weekend. We totally appreciate your time. And I am super grateful that you made this time to join us. And we look forward to interacting with you again. And Deborah, thank you. This was fantastic. Thank you for all those very thought-provoking questions. Truly appreciate it. And you're also doing some amazing work. And who knows, the two of you, your paths may cross beyond this. You're in Nigeria in the West, you're in, Zambia in the Southern, and you're both on the continent. So together, I think great things can happen. And to the attendees, thank you guys so much. Follow Copper Rose. They are on Twitter, they are on LinkedIn, they are on Facebook. So just visit the page, see what they're doing, see what interests you. She's shared her email with us. So please just follow her email, ask questions. Once again, thank you guys. Everyone have a fantastic weekend. And we'll call this to a close. Truly appreciate it. Thank you so much. On behalf of Poor Hair, have a fabulous day. Ciao.
Thank you.